The best approach to caring for a seriously ill or injured child is a systematic one. The purpose of this organized approach is to enable you to quickly recognize signs of respiratory distress, respiratory failure, and shock so that you can provide life-saving interventions. Your first step is the initial impression. Here's an example of how it works. The initial impression is your very first quick observation. What you see and hear when you first encounter the child before you even touch him will determine how you proceed. Questions you want to ask yourself are, how does the child look? Is the child breathing normally? And if not, what is different about the breathing? Is the child's color good? Does the child interact? Is the child conscious? Are there any obvious outward signs of circulatory problems? Any change in skin color or bleeding? Basically, in the initial impression, you evaluate the child quickly for any obvious life-threatening conditions. If there's no life-threatening condition, you will proceed with a systematic approach, the evaluate, identify, intervene sequence. If now or at any time during the initial impression you find that the child has a life-threatening condition, you should immediately begin resuscitation or other appropriate interventions and activate emergency response. Use the evaluate, identify, intervene sequence when caring for a seriously ill or injured child. This will help you to determine the best treatment or intervention at any point. From the information gathered during your evaluation, identify the clinical condition of the child by type and severity. Intervene with appropriate actions. Then repeat the sequence. This process is ongoing.
Hi, how are you? Nice to meet you.
Hi, Liam. I'm just going to take a look at you, okay?
The first step of the evaluation is the primary assessment. The primary assessment uses an ABCDE approach. ABCDE stands for airway, breathing, circulation, disability, and exposure. The primary assessment is a hands-on evaluation. Here you assess respiratory, cardiac, and neurologic function to identify the problem. This assessment includes evaluation of vital signs and oxygen saturation by pulse oximetry. Following the primary assessment, you should identify the child's condition, decide what interventions, if any, need to be started at this time, and implement these as appropriate. The secondary assessment consists of two components. The first component is a focused history which can easily be remembered by using the mnemonic sample, which stands for signs and symptoms, allergies, medications, past medical history, last meal or liquids consumed, events leading to the presentation. One goal of the secondary assessment history or sample history is to identify important aspects of both the child's history and presenting complaints, especially any information that might help explain the child's presenting problem. The second component is a focused physical exam. The thoroughness of the physical examination is based on the patient's presenting symptoms and history. At times, a complete head-to-toe examination may be deferred until serious conditions are adequately treated or to avoid excessively agitating a child with upper airway obstruction, for example. The diagnostic test uses ancillary studies to identify problems and guide treatments. This includes tests such as laboratory studies, X-rays, arterial blood gases, and an ECG. The diagnostic test is important for the thorough evaluation of any sick or injured child in order to determine a plan of intervention. The next step of the evaluate, identify, intervene sequence is identify. You need to identify any illness as either respiratory, circulatory, or a combination of both and identify the severity of the illness. Respiratory problems can be categorized into 4 groups: upper airway obstruction, lower airway obstruction, lung tissue disease, and disordered control of breathing. The severity of a respiratory problem may be respiratory distress or respiratory failure. Circulatory problems can be caused by arrhythmias or shock. The child should be placed on a cardiac monitor to look for arrhythmias such as bradycardia or tachycardia. Shock is further categorized into 4 groups: hypovolemic, obstructive, distributive septic, and cardiogenic. The severity of shock may be compensated or hypotensive. Remember that critically ill or injured children deteriorate rapidly, so one category of problems may lead to others. On the basis of your evaluation and identification of the type and severity of illness, decide what needs to be done. This is the intervention step. Your decision should be dictated by your scope of practice. When you do act based on your decision, actions may range from providing basic life support to specific advanced life support interventions. Remember, throughout your evaluation, always look for any life-threatening conditions. If a life-threatening condition is recognized at any time, immediately begin life-saving interventions, activate the emergency response, and follow the pediatric cardiac arrest algorithm. While treating a child in cardiac arrest, you should evaluate the child for and identify any reversible causes of cardiac arrest. These reversible causes are referred to as the H's and T's. You can easily perform assessments for these potentially reversible causes during the resuscitation. Begin your search for potentially reversible causes at the child's head. Are oxygenation and ventilation being maintained sufficiently to intervene for hypoxia? Evaluate the adequacy of ventilations. When ventilations are inadequate, CO2 is not efficiently eliminated, which results in respiratory acidosis. Obtain arterial blood gases to check for hydrogen ion imbalance. Check for hypovolemia. Circulation should be maintained by providing fluids via the IV or IO route. When you hold the extremity to start the IV or IO, note the skin temperature and correct hypothermia if noted. Obtain blood samples when starting your IV or IO and send for evaluation of hypokalemia, hyperkalemia, and hypoglycemia. Evaluate the chest of the child. Is there something going on with the child's lungs, such as a tension pneumothorax or a pulmonary thrombosis? Evaluate the child's heart for cardiac tamponade or coronary thrombosis. Finally, consider what is in the child's stomach. Did the child ingest any toxins? And remember, the evaluate, identify, intervene sequence is a cycle. You will repeat these steps throughout every stage of the process. This concludes the initial presentation of skills and information for the PALS course. Coming up, you'll get the chance to apply what you've learned.